This is the first time I'm meeting you, so I'm excited to have you here. Thanks for coming on. Could you just tell us your names and a little bit about yourselves, and then we can just get into it?
Sure. I'm Shandell Pino. I have Inner Light Academy. I'm an energy healer and psychedelic integration guide and a ketamine sitter. So I've been doing the energy healing work for about 12 years and then the ketamine work for just this year.
Okay, cool.
Yeah.
And then what about you?
Yeah, so my name is Nathan Unkefer, and I'm an emergency room physician. And I spent nearly 20 years, the first 20 years of my career, working in trauma centers and emergency rooms. And I have just recently transitioned to becoming a provider of ketamine.
Okay, how recent?
About 6 months.
Okay, so you've been into the, and this at the same center, obviously, right?
Well, we don't have a center.
Oh, it's okay. So you're
Yeah.
providers, though.
Mm-hmm.
Okay,
Yeah.
very cool.
Yeah, so we met because we're kind of in the same category of work with the psychedelic sitting. But she's had her own thing for her career, and I've had my own thing for my career. And now we've kind of come together to
Merged
team up.
paths, right? And you said 12 years in your
For energy healing.
for energy healing. Okay,
Yeah.
very cool. I can't wait to dive into that because he was mentioning sound and meditation and all those things that kind of help basically guide the patients into the ketamine session. But I think let's start with what is ketamine first and foremost for those that aren't introduced to it. I mean, we do hear about it a lot these days, and I think we were talking to at the start where it's like we've gotten to a point where a lot of people are looking at different options anyways, and this has very sound data to back like the ability to help people with so many different ailments or whatever. So maybe let's start with what is ketamine first and foremost.
Yeah, sure, I can probably take that one.
Yeah.
Okay.
Yeah, so ketamine's been around since the 1950s,
Okay.
and it's been used since that time as a anesthetic to kind of knock people out for either surgery, or in my case, I would use it in the emergency room to put people to sleep for painful procedures if they had a broken bone that needed to be reset, or a complex laceration that they had to be still for. So mainly used as anesthetic, but in the last 15 plus years, it started showing a lot of benefit for people with mental health disorders.
Mm-hmm.
And so kind of unexpectedly, people who were getting ketamine for anesthesia were reporting that they would feel significantly better from a mental health standpoint. And some researchers in the early 2000s kind of picked up on that and started doing some studies and giving ketamine to people with depression and PTSD and anxiety, kind of the three big categories, and seeing like kind of amazing results in terms of how people would positively respond from a mental health standpoint.
Mm-hmm.
And that research has just sort of grown and accumulated to the point where it's pretty well accepted by people within the medical community that it truly does show benefit for people.
When did that transition occur between using it how you did before for an anesthetic, you said, into where we're seeing it now? Like, when did that? I mean, I'm sure there was a trial like phase and everything, but now it's like you said, very well accepted. When did that time frame happen?
Yeah, it's been a slow transition over 15 plus years.
Okay.
But I would say maybe in the last 5 years, the research has really gotten down to studying what's happening at a cellular level, like the actual mechanism behind why it's making people feel better. Because before it was just people reporting their symptoms, like, yes, I had some ketamine and now I feel better. But, that's kind of hard to suss out, like, to measure how much better they feel. But now that the data is coming out showing what it's actually doing to your brain, and we're seeing positive changes, like changes to the neurons in your brain, and that's correlating with that they feel better, that people are like, okay, now it's making sense. Like, people feel better, and this is why. And now I'll jump on board to kind of believe that it's working like it's been reported.
Amazing. That's cool.
Mm-hmm.
Thank you. I also had a question of maybe how it interplays with other like psychedelic therapies possibly? You mentioned, did you say psychedelic facilitator? What was the?
Yeah, so I'm not a facilitator.
Okay.
I worked with plant medicines in the past.
Okay.
It's not legal, so there's complications around that.
Okay.
So I decided to become a sitter, and I decided to become a sitter with ketamine because it is legal, but also because the benefits were so like fast, and the people who are looking for those changes, you know, I can say, you know, psilocybin is an amazing way to reprogram your brain also. And then people are like, well, how do I find that? Where do I get it? All of those different
Much
types
more
of
complicated
things.
to
Much more
figure out.
complicated, yeah. And the ketamine is super fast. Like you can see results really quickly. And so the both medicines have a place in the healing of the brain. So, yeah.
Walk us through what a session might look like for someone that's interested in ketamine. How does it start? How long does it last? What might one experience during that? Lots of questions there. But.
Yeah. And we have a couple different options when we work together and then when he works on his own. So I'll talk about when we work together.
Okay.
When someone reaches out originally for a ketamine treatment, he will book with them, take care of all of the medical things, and then they have a call with me. We kind of talk about setting intentions, what they're hoping to get out of the ketamine session, and then based around that, I will curate a playlist that is specific for their intention to listen to during their journey. Then when we get to the home, we set them up. I make sure they're nice and comfortable and relaxed, take them through a little bit of breath. Then he injects them, we play the music. And then I'm there to support if they need support, because sometimes it can be a really difficult journey or really intense if no one's had a psychedelic experience before. And so I'm there to either hold hands or just talk them and remind them to breathe, things like that. And then I help bring them out back to the space, back to reorienting themselves. And then I usually have a call with them afterwards just to kind of go over anything that they need help integrating. And then if they want to work with me more after that, then that's an option.
Okay.
We also have a group session that we do. And in our group sessions, it's a lot more in depth. So same kind of setup in the beginning, but once they get there, we do breath work, we do meditation, we do sound bath, and then they drop into the journey, and then sound bath to bring them out. And then we have time for like a group integration.
Okay.
And snacks, and then they're like not in any hurry to leave. There's plenty of time for them to come out.
Something I love about like hearing about these modalities is the intention and the environment. It feels like, I mean, intentional, I guess I already used that word, but for the healing journey, I guess, and offering that space for people to really work through what they need to work through, you know, that feels like it's very focused these days, and I feel like that's a really positive thing.
Yeah.
And what about for you? You mentioned that sometimes it doesn't look like that when you're with the music, and is there other ways to administer ketamine as well?
Yeah, let me before we get into that, I want to piggyback on what she said.
Please.
I don't know if people understand, and I didn't even understand until I've kind of gotten into using it in the way that we're using it. When you're given ketamine, there's a very intense kind of psychedelic experience that comes along with it. If you're just looking at the medical side of it, just the drug and the mechanism of action, here's like the tiny recap. Ketamine binds a receptor in your brain that the glutamate, which is a neurotransmitter in your brain, glutamate typically binds this receptor. Well, ketamine comes in and binds it, and it leads to this cascade of events that leads to a rapid firing of neurons all over your brain. All these neurons fire kind of simultaneously, and because they are firing so rapidly, there's a protein released. It's called BDNF, doesn't matter, but it's a protein that is a stimulant to tell the neurons to start growing connections, new connections between themselves. So you get this within 4 to 6 hours, you start to see a rapid growth of the synapses, the connections between the neurons. And what the goal is for these neurons to form these new connections so that you can have new ways of thinking, So instead of being stuck in the old ways of thinking, whether it's depression or anxiety or a trauma response, what you hope is that you sort of grow these new neural pathways, and now instead of falling into the old negative loops, you can have a positive loop, so you can have more positive thoughts. And so that's like the recap of how it works, and that's when people refer to the neuroplasticity. That's what they're talking about.
So it's actually creating new neural pathways, which creates like actual like new ways of like seeing things and perceiving things and just experiencing things.
If it's used correctly.
Okay.
Because like if you don't use it correctly, if you are going into a ketamine session and you're on your phone searching social media or news, or even the 24 to 48 hours after the fact, you're programming your brain to still search for those things that are really causing you stress and anxiety. So that's why, for me, that's why I wanted to get into this, because so many people are doing ketamine, and I'm like, but are you doing the work after the fact? Because that's where the real true work, is so important. So that's, I mean, I can talk about that all day.
Yeah, no, absolutely.
Yeah, and I think that's why we work so well together, because I can give the medicine, and there are some small risks associated with it. I mean, people, especially in the news right now, are hearing about Matthew Perry and people becoming addicted and overdosing. So there are some small risks associated with it, and that's where my training comes in, because I can give you the medicine, I can deal with any complications. If you stop breathing well, I'm there with my oxygen and my airway equipment. But when I was talking about the experience that comes with it, when you get ketamine and your neurons start firing all over your brain, your consciousness, like your soul or whatever it is that makes us perceive the world, doesn't know what to do with all these neurons firing at the same time. And a lot of them fire in the occipital region of your brain, which is the visual cortex. And so your consciousness takes all these neurons firing and it tries to put it together into something that makes sense. And what you end up with is a pretty intense psychedelic experience where people typically have lots of visual hallucinations and will completely dissociate from their body. So you disappear into your consciousness, into the hallucinations, and for 40 to 60 minutes, you're like traveling through your brain and through the universe and like having this wild experience with it. And if you're not prepared, it can be scary. And people can have, quote, like a bad trip or an anxiety reaction while it's happening. So the preparation, the guiding through the experience, and then trying to figure out what to do with that afterwards. This is what
Key
Shandell
elements
does.
to that,
Yeah.
Which during all of that, if you're not someone that's ready for that experience, I don't know if that's the right word or whatever, but that, having you in that space and having the proper way to do to heal and be doing ketamine, that's where the value comes in, because it's like I can only imagine if you're stuck in that, but then you have that grounding factor of what you can offer there is like so vital to that experience, I'm sure.
Yeah, and also, when I do go with him, I do give the option of me to do energy work during the process also. So I don't necessarily always just sit there and hold your hand if you need to, but I can also see the energy, and if something starts to kind of come up to that it's like gonna get blocked or going to be really intense for you, I'm there to help move that along so that you don't get stuck and then end up in that bad trip or scary experience.
Or help to move through it, or in and through.
Yep.
The other side of that.
Yeah.
Very cool.
Yeah.
I love that.
But we interrupted because there is the option of him just going by himself.
Yeah. I'm very curious. Is there a big difference between that space, or is the experience on the patient's end, is that going to be kind of received this in a similar manner, or can that change? Does the environment change that?
And actually, we haven't touched on this yet, but when you were saying like the environment matters so much, in the psychedelic realm, people will say the set and the setting. So your mindset going in, and then the setting of where you do it. Because if you're in a place, if there's any sense of like being uncomfortable or scared going into that psychedelic experience,
Both here or here, right?
Yeah.
Right.
And so the way that I think that makes us kind of unique in the model that we're using is that we do house calls. And so we don't have a clinic or a space. We literally will go to the patient's home, and they can do it in bed or on the couch, surrounded by their loved ones, their pets,
Oh, I love
their favorite
that.
blanket.
Yeah.
And that I found that just puts them into such a peaceful, comfortable, safe environment
Mm-hmm.
that the transition into the actual experience is kind of I think significantly better than if you're in a clinic, even if the clinic is set up nice and there's a comfortable chair and there's the staff members are nice, like you're still in somebody else's space.
Yeah, I can see that being very beneficial, just having that opportunity.
Yeah.
And he does still offer the music, and like, you know, I've created lots of playlists, so he'll use some of the playlists, and so he does still offer that, like, comfortable, and just his personality, you can see, is very welcoming and comfortable. So even when I'm not there, he does still offer his own, like, energy to the space.
For sure.
Yeah.
Absolutely.
Yeah.
Which is very important.
Yeah. I mean, I'm definitely more the Western medicine, science-based, I'm on the data in front of me kind of guy.
Mm-hmm.
And then Shandell is definitely more of the metaphysical, sort of spiritual side of things. But it's there's a big crossover with ketamine. I think it's the only medicine I've ever given in my career that
That crossover makes so much sense.
you have to support both sides of it.
Mm-hmm.
And they're equally important.
Yeah. So I've heard a lot of, I don't know what else ketamine treats, but I've heard a lot of people show their interest because of depression, anxiety, PTSD, and stuff like that. Is there any other, is that what you mostly see people for, or are there any other benefits to the ketamine experience outside of even the mental health and, like, you know, you've mentioned the neuropathways and all those things, but is it strictly focused on those, like, ailments like PTSD and depression and anxiety?
So those are the three big ones.
Okay.
And that's only because that's what the majority of the research has been done on so far.
Okay.
There's also good data, well, moderate data to support what am I trying to say? Addiction medicine. So
Oh, because the pattern.
To treat addiction.
to treat addiction. So like alcohol addiction has been studied.
Mhm.
There's some good studies that have come out on bipolar disorder, improving that. And now what I'm going to say is definitely kind of stretching it. But theoretically, if it's forming new connections and new synapses between your neurons, the thought is, could it be helpful for all kinds of different neurodegenerative disorders?
Mhm.
And there hasn't been any definitive data yet but there's lots of ongoing studies to try to figure out if it could help with Alzheimer's, Parkinson's, things like dementia, things like seizure disorder, people who have had brain injuries from stroke or traumatic brain injuries. Because if it's reforming connections between neurons in your brain, it kind of makes sense that it could be helpful for all sorts of additional things. The data and the research just isn't there yet to say whether that's true or not.
Okay. I have a few questions I was going to look over real quick. Something I was curious about that I wrote down is how do you determine if someone's a good fit for ketamine? Because there's so many different, like, modalities out there, and like we mentioned at the beginning, I mean, we're kind of moving away from some of the methods that we've thought were the only methods in the past, right? How can you gauge that someone might be a good fit for that experience? Either of you. I'm actually curious too what you might say, because you mentioned you have like 12 years as a healer?
Right.
I feel like that's a good place to start.
Sure. So most of the time people come to see me because they feel off. They just don't know why.
Okay.
And so, like, the work that I've done is definitely more energy-based. And I do a lot of energy kinesiology, which is Chinese medicine working with the meridians of the body, which is how emotions show up in the body. And so sometimes I'll get people, I'll be like, I'm really sad, I don't know why. or I keep having this pain in my shoulder and I can't figure out why. I've gone to the doctors, they say everything's fine. And so then I'll go in and we'll start talking about the emotions and how the emotions are affecting it. And so when people come to see me, it is that emotional factor. And in the last year, I've had so many of my clients being like, well, I want to go try ketamine. Or I did go try ketamine and I didn't know what to do afterwards. And they threw me in a car and like all of these things. And I was just like, wait. And so it is definitely for the people who are looking to find themselves again, to find that happy place in them again, and aren't sure where to look. And they're scrambling outside of themselves to find that answer. When truly the answer is inside. Whether you're doing a psychedelic experience, whether that's plant medicine or ketamine, the answers are still inside, right?
These are just
tools to
help us.
open it and help us see those things that are already inside us. And so it's definitely the people of my people that are coming to try it. It is definitely to get them to remember themselves, remember who they are, remember how to see life in a more beautiful way, how to find those connections to other people in their lives, to nature, all of those types of things. And so it's definitely, I come from the energetic state, but that energetic state comes right to their emotions. And that is everything that we all experience.
I love that. Thank you. Thank you for sharing that.
And then maybe I can answer the same from more of a medical perspective. There are a few things that make people not good candidates for ketamine. So like if you have severe respiratory issues, you probably don't want to do it because it can sedate your breathing a little bit. It can make your blood pressure go a little bit high temporarily. It can make your heart rate go a little bit high. So if you had uncontrolled high blood pressure or, like a very unstable like cardiac heart condition, there are a few things that make people not good candidates. What makes people a good candidate is kind of changing recently. Most of the studies at least the early studies were done on people who were considered treatment resistant, depression, anxiety, PTSD, meaning that they had tried other things. They had been through therapy, they had been on more than one different antidepressant medication and have failed. And then those were kind of the people that they were focusing the studies on initially. And so for a long time, it was that ketamine should just be last resort. You failed all the traditional methods, and now you can try ketamine. That's kind of changing, and it's definitely changing in my mind, because when you look at the data behind how well ketamine works, the biggest studies and sort of the most cited studies will show between like 60 and 75% of the people who undergo ketamine therapy will have a significant reduction in their mental health symptoms. And again, depression, anxiety, PTSD, OCD, like just in general, upwards of 75% of the people have a significant reduction. If you look at the data behind like the SSRIs, which are the traditional antidepressants like Prozac, you see people showing like a 20 to 40% success rate. And so you look at ketamine and you're like, that's nearly double as successful as the traditional antidepressants. And so then why do you need to fail the traditional routes before you're offered ketamine? So it is changing. And in my mind, it's changing because some people don't want to be on a daily pill for the rest of their life.
Especially if you're on SSRIs for like 20 years.
Yeah.
And with ketamine, is this data coming from, kind of leads into my next question too, is it coming from one session, or are you repeating, I don't know how that works exactly.
Yeah. So it's been found that a single session will help people, but it does wear off. So like on average, if you have a single session, you'll have symptom improvement for like 7 to 10 days, 2 weeks. But then it kind of peters off and you seem to go back to your baseline. If you have more than one session with ketamine and kind of stack them closer together, you get this phenomenon where the symptom relief seems to last much longer. And so, again, there's no like a totally agreed upon protocol between the different providers or between the different clinics. But in general, what the consensus is, if there was one, is that most people are recommending 6 treatments in a relatively short time period, like less than 2 months. So like once a week times 6. And the research shows that that can hopefully provide like 6 months worth of symptom relief.
Wow, that's incredible.
And then after that, you may, depending on how you feel, you may need intermittent, what we call like a booster shots, like just maybe once every 6 months ongoing.
I was going to ask, is each session, like, are you going equally as deep into the experience? Or like you mentioned the booster, is that like kind of not a full dive, I guess?
Yeah,
I do the same. Well,
because how ketamine is served is by your weight.
Okay.
And so, and you can speak to that more, but like he does, say if your experience was this and you want to go a little bit deeper, there may be a little bit of wiggle room there.
Okay.
But you basically, it's the same dose based off of your weight.
Per individual is different.
yeah, I start with 1 milligram per kilogram based on body weight. And then if they didn't have a very deep experience, or if it was too intense, we'll adjust subsequent treatments.
Okay.
And my thing with integration is, once you have your 6, if you're truly doing the integration work after the fact, I feel like the need for a booster will not come as quickly as people who are not doing the integration work. So if you just go and have the experience, then you go back to your everyday life, chances are you didn't program enough to make it last long enough.
Gotcha.
So, and that's my belief outside of Western medicine, right? And so there's that. But I also kind of wanted to say is I'm a firm believer that the medicine that's right for you will call to you. And whether that's a plant medicine, ayahuasca, psilocybin, and not MDMA is not, but 5-MeO-DMT, or ketamine or MDMA, the one that's meant for you to really reprogram and help you is going to be the one that calls to you. So not every medicine is for everyone.
Right.
So you can go try ketamine, you're like, I hated it. And I'm going to ask you the questions. Tell me why you hated it. Was it the experience? Was it that you didn't have support? Was it that you were in a room all alone? All of those types of things. Or was it really the medicine that just didn't work for you? Because either can be the case.
Right.
Yeah.
Yeah, it's not just one pill fix all. It's like so many different approaches to this, and
Yeah.
so many different people and reasons for the approach. You know.
I think you said it exactly right. It's not a cure-all, and it's not just take this medicine and you'll feel better. You have to do the work afterwards.
Which I feel like that's something is like, it's probably not new, but I feel like it's something we're more looking at these days, where it's like, it felt like it was just like, oh, a pill here, then you're good, just whatever, and then you just move on with life and just get on with your duties or daily tasks. But it's like, this feels much more getting to the root, or at least the attempt is there, right? The intention to like really get to the root of the issue and integrate after the fact. It's not just like, oh, I did ketamine, now I'm healed. It's like, creates that space and maybe that experience, and then there are a lot of things happening there, but then you're integrating into the next phase of your life, I guess, right? Sorry, what were you gonna say?
Well, your thoughts are very similar to, say, like learning a new activity. So if you're trying to learn to play the guitar and you pick it up and you start to practice, you're bad at it. But if you practice it 1,000 times and you force your neural circuits to like run that same circuit 1,000 times in a row, it literally, your brain grows new connections and it grows this new neural pathway. And now you can pick up the guitar and you can play without even thinking about it. Your thoughts and your emotions are very similar. So if you fall into the pattern of depression and anxiety and trauma response, and you think that same way, and you get caught in these like worry loops or these anxiety loops, you're reinforcing that pathway and it's growing stronger. And so what ketamine does is it releases this protein that we talked about, which is essentially like a fertilizer for your brain and your neurons. And it tells your neurons like, hey, start to grow some new connections. But the patient's job is to try to force those new connections to form in a new loop. So if you get ketamine and then you fall back into that same thinking pattern, you're just going to make the old...
Reaffirm the old pattern.
Exactly.
Like what you're saying with the phone and everything, right?
But if you can start, and it can be as simple as, you can fake it with mantras. You can spend your times being like, everything's okay. I'm okay. Or something simple like that. But then you form the new pathway that is saying, I'm okay. And maybe the next time that you face a difficult situation that you would have fallen into your old emotional
You
patterns.
actually are okay.
And now you're like, wait, I'm okay.
Yeah.
You know? And so but you can't just leave it up to chance. You have to train your brain to do it the right way.
And it's funny, in my work, I've used affirmations for years, and like I have a whole little program on how to create affirmations that are your affirmations, not just the blanket affirmations you can get online, right? They're specific,
Tailored to your needs.
to what your thought patterns have been, to reprogram those thought patterns. And so, but my method is like the old method of like, really, this is what you repeat, this is how you do it, because taking the long route to reprogram the neural pathways. And now with ketamine, it's like sped up, because you have that really super active 24 to 48 hours where if you're really diving in and taking that time to focus on those affirmations and positive and feel good things, it's really fast.
Outside of like affirmations, mantra, and stuff like that, what other integration tips might you have for someone that is in that phase or thinking about this?
Yeah, I always suggest get out in nature.
Seems to be the answer.
I know,
for
right?
everything, right? It just seems to be
It
the
seems so
go-to.
easy, and yet we don't do it. In fact, on my way here, I was driving and I was looking at the clouds, and yes, it's a cloudy, rainy, gray day, and there were so many textures in the clouds, and I was like, oh my gosh, is anybody seeing this? I'm like driving on the freeway, and I'm like, anybody seeing this? Because it's now my natural inclination to look outside at the beauty rather than stuck in traffic at the cars around me and not paying attention to those kind of things. So definitely one of my number ones is to get out in nature, and it's to connect with people that make you feel good, right? Have the conversations with people that you love, and have good conversations, spark new conversations, not
That
the old
facilitates
complaining.
the new kind of, what would you call that? I guess like this new mindset after a ketamine session, like.
Yeah, well, I think that's the neuroplasticity.
Okay.
That's your new neurons growing. But yeah,
Find ways to support that, right?
Yeah.
And then also trying to avoid the bad loops that you used to be in, which is silly to be like, don't be sad for 2 days. But kind of you can set it up so you have 2 days where maybe you aren't going to work, maybe you have some activities planned that are making you happy, maybe you agree with your partner that you're not going to discuss the things that are difficult for a couple days, like let's put our arguments to the side. But yeah, I mean, that is integration. That is training your brain how to take advantage of the fertilizer that your synapses just got from the ketamine treatment.
Which is so nice, because a lot of people might not even be aware of some of the reasons why, like you said, it's like, why am I feeling this way? Or like the patterns have been so ingrained maybe that the ketamine seems to, at least from what you're telling me, seems to offer that space to finally kind of make those connections, so then you can know where to start to work with, I guess.
Which is what's so interesting is, like you said, we were given a quick pill and go back to the rest of your day. That pill was made to like shut off our emotions. And so like, well, if you're not going to feel that you're sad about it, you can just go about the rest of your day. But we're numbing through life, where ketamine and other psychedelics actually opens you up to the fact that you are going to feel all of these things and you are going to have all of these experiences. It's what we do with those experiences that matter. And so it gives you more of an opportunity to make the changes instead of just numb and go through life.
Yeah, now it's like the education behind them, the expertise behind, or the actual environment. It's like now something we're paying attention to, so we can go into this experience properly and feel all the things instead of maybe in a bad setting, right? So where do you guys see the future of, is that something you've thought of, like the future of ketamine maybe in the next few years, or I don't know a time frame, but just kind of the trajectory possibly? Is that something you thought about?
I mean, I personally think that it is going to be the first route before antidepressants. What I hope.
The focus there
The
will
focus will be much more of like, let's see if we can get them through the 6, treatments or however many that ends up being with studies, and then checking in with the patient. But really, truly taking the integration piece into account.
Mm-hmm.
And then from there, see what the other options are instead of just immediately just like, here, let's give you this.
Yeah.
That's what my hope is.
Mm-hmm.
Yeah, I agree. Like I said, I'm very science and data based, and everybody knows there's fads that come along in medicine, and a lot of times they're not backed by any data or good data. And you see things like IV vitamins and colon cleanses and, like these trends that kind of come along. And truthfully, I kind of lumped ketamine into that category for most of my career because I was using it in the emergency room, but I wasn't using it for mental health. And I've heard people talking about it and was like, yeah, okay. But as more data comes out and like good research papers from big institutions like Yale and Stanford are kind of two of the big ones driving a lot of the research. And as the data comes out showing what it's doing, correlating with people feeling better, like I truly believe that it's the real deal. And it just over and over again proves to be doing what we think it's doing. And so I don't think there's any going back now.
Mm-hmm.
I mean, the
More momentum.
the
forward.
knowledge is out. It's proving that it's working. And I can't imagine that it's not going to just keep growing.
Yeah.
We see so much success, even just with the people that we're treating. We see so much success, and it's really rewarding.
Yeah. Can you share some success stories with us? That was going to be my next question. If there's like I don't know if there's any that you could, generally speaking, like share about some sort of story that's happened that you guys have witnessed.
Yeah, I can, I think. So it was actually one of our first clients that we had together. She was going through like an extremely difficult time. Marriage was kind of falling apart. And she was always more of so in like the negative mindset, always searching for like what could go wrong, what's going to happen, nitpicking, all that type of stuff. And her today is like a completely different person. She's super positive. She's always looking for like, oh, I found this today and it was so exciting. And so we'll get messages all the time. And I had we met with her husband at the very last session, and he said that the change in her has been incredible. And then I met with her and her children, and her children said, whatever you're doing with our mom is working. And I was like, oh my gosh.
Even the kids could know.
Yes. And these are like young adult children. So they had grown up with her like all of these years, and they were like, whatever you're doing, like it's working, keep doing it. And she loves to just talk about how it has completely changed the way she sees life. And
Wow.
Yeah.
Yeah.
And that's, and we have so many stories like that.
Which is probably why you guys do what you do. You're able to truly help people.
Yeah.
Yeah.
And see it, like literally see from the first time we walk in, and you can just, and for me, you can feel how heavy their energy is. And you can feel that they're almost sometimes so desperate for anything, right? Which I think is where a lot of people get to when they're going to go to a psychedelic, right? Is they're so desperate for relief. To even by like our third one, they're like, I'm feeling so much better. Like, I think this is working. And the lightness. And then by the time that it's over, it's night and day.
Wow.
It's insane.
It's not, well, it's cool because not only can you feel the difference or like go into a session where it's like you can actually see it, but there's data to back it, like on this side of things where it's like, it's the perfect mix right here, I feel like. So it's, yeah, like you guys said, the trajectory is just bound to move forward very successfully.
And then I wanted to tell you this one too. One of the things that makes ketamine different from other antidepressants is how rapid it can work. And so, like, I keep going back to the research, but within 4 to 6 hours, you start to see new synapses growing. And they
In 4 to 6 hours?
4 to 6 hours.
Wow, okay.
And then
the session itself is like an hour, right?
Yeah.
That's what you said?
Yeah.
Okay, wow.
The actual experience is 40 to 60 minutes.
And then within those first 4 to 6 hours after the fact.
You can start to see synapses growing, and they'll grow for up to 48 hours. So you have this 48-hour window where they'll start to grow. But it also will change people's symptoms that quickly too. And so we had seen a lady relatively recently, and we did the session, everything went well. And then 2 days later, she texted me because everybody gets our cell phone numbers. They can call us anytime. But she texted me and she goes, "How long does the ketamine stay in your system?" And I was like, "What do you mean, like 2 hours?" It was out 2 days ago. And she said, "Because I feel different." And I was like in a good way. And she was like, "Yeah, the last 2 days have been like great."
The best days I've had in a long time.
And
I love that.
I was like,
That's
"Those
so
are your
cool.
new synapses." Like, good job.
I got all excited.
But that's what some people need, is
Yeah.
like literally to feel and experience something like different out of their
Different.
ordinary. Like some people are deep into maybe even 20, 30 years of some sort of pattern that's really been detrimental. And then this offers that space to really tap into something different and really start to like move a different way in life.
It
So you
gives
guys
them
are
that
doing really good
glimmer,
work.
that
Yeah.
glimmer of hope and that glimmer of like a moment of happiness that they can just attach to and be like, wait, I remember what it was like. to
Yeah.
feel
She's
it."
like, wait, this isn't the ketamine anymore. This is
Yes,
This is
exactly.
me?
Yeah. She felt so good for 2 days that she
Yeah.
was like, "It's got to still be like in there." And
Mhm.
I was like, "No, it's like metabolized and gone in 2 hours."
Wow.
Yeah.
That's such a good story. I love hearing that.
Yeah. And even that same client, the second time we went, she texted him a couple hours and was like, "I'm feeling some anxiety."
Mhm.
And he said, "Put the playlist on, go outside, go for a walk."
Mhm.
And an hour later, she sent him a picture of the tree. And she's like, "I saw this beautiful tree while I was out here. And I'm so glad you had me go outside. I'm feeling so much better." So it was like, yes, you're still going to experience anxiety, stress, or any of those things. But what are you going to do with it now that you have the opportunity to reprogram?
Right.
And it was as simple as put on the playlist and walk outside.
How important is the music aspect of guiding people into the
Yeah,
session?
I really feel like music is really, really important. And that's why I like to meet with people beforehand to know what their intention is, because I can curate a specific playlist, whether it's hertz, frequencies, specific songs, that will help guide them into that reprogramming of the brain, because music is so powerful. And you know, if you go in, silence can also be powerful, right? Just dealing with your own stuff. But to have the music kind of
Carry
support you and through the experience. And you know, we had one client a couple weeks ago, she goes, "I almost had you turn off a song in the middle of it." And I was like, "Oh, was it this song?" And I put it in there on purpose. It is to trigger the part that needs to be healed. It is to bring
discomfort.
it, it's to bring it to the surface, so that, because the next song is going to be the one that supports you to work through it, right? And so it's not that I don't want to trigger you, because sometimes I do, because
That's what healing.
that's what
sometimes
healing
looks
is
like.
about,
Yeah.
right? Is to be able to know that you can get through and it can move through to the next piece. So I think music is huge.
Yeah, when I was telling you guys at the wellness center, they were actually had someone do the sound bowls during that. That was really cool to watch.
Yeah.
Yeah, I saw a lot of really amazing. Like, it was always in a group setting, but I could really see the change. So my curiosity for ketamine automatically was there when I was able to witness that environment.
Yeah.
Did we touch on everything else? Did we miss any? I want to make sure that if someone's listening to this, they really understand what ketamine is. If they are curious about it, they can feel comfortable, maybe even reaching out to you guys.
Yep,
If
absolutely.
yeah,
We're happy to answer any
Okay.
questions, whether that's, you know, through social media DMs or direct text messaging or phone calls. We're happy to answer any questions.
okay,
Yeah, I think what sets us apart a little bit, in addition to being mobile, going to the person's home, it's just us. We don't have a secretary or a staff. And so when you text or call, the number on my website goes to my cell phone, and it's me that you can get, you know.
that's
If
wonderful.
I'm
yeah.
sleeping, I won't answer it, but pretty much immediate response.
Yeah.
Okay, awesome. So you said social media or website. Can we get that information? We'll also leave that too. But if anyone is curious, maybe has some questions, that they could reach out to you or follow you online.
I'm on Inner Light Academy on Facebook and Instagram, and then my website's innerlightacademy.me.
Inner Light Academy. Okay.
Inner, INNER.
Okay. Perfect.
Yeah, and my company is called Guided Ketamine Salt Lake City. Like, I'm your guide, so Guided, and that's the website, www.guidedketaminesaltlakeCity.com.
And
Okay.
he's also on social media, both Facebook and Instagram.
Yeah, same thing, Guided Ketamine
Okay.
Salt Lake City.
Perfect. Yeah. So make sure to follow and reach out if you have any questions. I mean, this has been super enlightening for me, just to kind of have people that are in the field teach me about it instead of just observing it. You know, I was working at that place, and it's so nice to have the questions I had answered. So I really appreciate you guys
Yeah.
sitting down with me.
Yeah.
Thank you so much for having us.
Yeah, of course.
Thanks.